Hey there, Dr. Carter here with you right now. I want to talk to you. We're getting into the fall. We're getting into allergy season, colds, flu, sinus problems, kids with strep throat, ear infections, sore throat, the flu, list goes on and on, okay? And what I want to do is show you how you can prepare yourself for these situations. For instance, if you or a family member always seem to be the one that always gets the sinus infection, always gets the strep throat, it's your child that always has the ear infection, the strep throat, the temperature, and it repeats, and that repeats. And you're always on antibiotics. And you know antibiotics all the time cannot be good for your child. Well, one thing, they're going to kill the bug, but they kill all the bugs in your body. They kill all the bugs in your child's digestive system. So after they've been on a course of antibiotics, they have no good bugs in the digestive system. They don't absorb nutrients as well. This goes on and on. Okay, so if you are one of these folks that get these infections and allergies, I want to go through some genetics that we do here at the office for genetic testing that will really let you know why you are the one that always gets that. Why your child or family member or grandchild is the one that's always sick all the time when others are not. Okay? There are several other factors that we can do blood lab for, which are important, but when it gets down to the nuts and bolts, it's your genetics. Because we all know people who never get sick, and we know people who get sick all the time. So what I want to do, this is a patient of mine's report. Of course, you won't see their name or their information or anything like that, but what I want to do is go through some things with you, things that I see here at the office on a daily basis, and then I give advice to people on how to overcome these deficiencies. So, for instance, we're going to look at the detoxification pathways. And the genetic test I do is through genomics nutrition, okay? So if we look through the detox pathways, when we go here where we have negatives, negatives are good, okay? Positives and negatives, you got a problem. A double positive means that's a homozygous, which means that individual has a deficiency given to them from their mom and from their dad. So in this particular situation, the NAT2 gene, they have clinical problems with that gene. And don't get confused with all the numbers and what you would look like as a rhetoric, because in just a minute we're going to scroll down and it's going to explain what all this means to you, okay? I just want you to see a page of what I see every day. Diamine oxidase, they're double-double, that's a problem with that. Histamine breakdowns, chronic infections, chronic inflammation in their system. The HLA genes are the ones we test for being able to break down gluten. People that are gluten intolerant, we can test for that and find out. Okay, it's easy, it's a cheek swab. It takes a minute. Okay, we can find these things out. The VDR TAC, this is the big one. That's the vitamin D receptor. Most people look at vitamin D as going, well, it's for my bones. Well, yeah, kind of, it is for your bones, but it's also crucial for the immune system as well. So they have a deficiency in being able to even absorb vitamin D. We look at the VDR TAC, the one we talked about a second ago, the vitamin D receptor. If you have problems with this, we're going to have impaired function and immune weakness. If you're the parent of a child that's always sick, do yourself a favor, get the genetic test done, find out why they're that way all the time. Save yourself all those doctor's office visits, save your child's body from all the antibiotics that they're going to be taking. Find out what you need to do. And the neat thing about all this, guess what? In biochemistry and genetics, it's all about putting back into the body what's not there. If you have a genetic deficiency, we can overcome that with natural supplementation. In biochemistry, it's all about natural supplementation. There's no biochemical pathway that says you have to have a medicine made from Eli Lilly or Merck or any pharmaceutical, okay? If you want to get better, you can do it naturally. Find your genetics first. Give us a call here, 752-1800. You can email me, drcarter720@gmail.com. We'll get you started on the genetics testing. Also with the genetic testing, it's not covered by insurance. There's no genetic test covered by insurance. The test itself is $399. We do the test, we send it to the lab, they send it back, I sit down with you, I go over the test, I go over everything you need to know about the test. But this is just good information for you out there. Give us a call if you need it. Thanks much. Have a great day.